Welcome back to our hair loss treatment show, episode 9. Today we are talking about robotic hair transplant. As you all know, hair transplant is a very lengthy and laborious procedure. So is there any automation available in the field of hair transplant? Yes, there is a robotic technique in hair transplant which is available in the name of ARTAS. Now, as we know, hair transplant has two basic steps: extracting hair follicles and implanting them in the front or in the bald area. Now, ARTAS robot helps us to extract automatically, the machine itself does the procedure, as well as to implant. So, both the steps are taken care of with the help of this robot. So, then the next question is, wow, that sounds fantastic. That's the best way to go ahead. Robot, as the name suggests, usually has more precision as compared to human hands. So that can perform your hair transplant surgery better than a human hand with all the human errors. Now, that is where you need to have some information and some knowledge about. That is a robotic hair transplant better than a non-robotic or surgeon-driven hair transplant surgery? So the answer is, it depends. Not always is that robotic procedure is better than a properly good experienced surgeon. Now, how does that matter? So, what the robot exactly does here is, on the scalp in the donor zone, a grid is fixed. We stretch the skin and fix up a grid that this is the area where the robot has to work. There are different parameters in the screen, in this display that we have to adjust. We have to adjust the placing, that how near or far we want to extract the hair from. We have to adjust the depth, that at what depth you actually want the robot to penetrate and cut the skin and take out the graft. Because that varies from person to person. Few people have thick skin, few people have thin skin. And then you have to decide what diameter of punch you are going to use for that particular patient. It also depends, it varies from person to person. Hair thickness, few people have thicker hair, larger diameter, few people have thinner hair, smaller diameter. Now, when a person is operating, when the surgeon is operating, all these parameters, they keep on changing these parameters as they go on operating. There's a tactile feedback. When we are punching the skin, we know that at this depth, we felt that loss of resistance feeling. Okay, this is the end of the depth. Take it out. Again, you go in. This was little longer graft. Go a little bit in and then you come out. But in robot, you don't have that tactile feedback. So all that you have to do is do all the settings and parameters beforehand before you really start the procedure. Placing depth can still be managed. They have a very narrow zone. You can make it a little more or less. When it comes to diameter, that what exactly the diameter of the punch should be in order to take out the graft in total. Now here there are many variations. So any particular graft, when you have, say for example, two hair graft, they can be lying parallel to each other. In that case, the diameter is same here as it is here. So taking out easy. Sometimes you have splayed end. In that case, diameter here is smaller as compared to diameter here. So your punch with a smaller diameter is not going to accommodate the deeper roots which are splayed apart. And then as you go with a smaller punch, you go on making transactions. You go on cutting your hair follicles. As you supervise your hair follicles, you come to know that, okay, this diameter is not sufficient, I need to increase the diameter of the punch. So in that case, when you are using a larger diameter punch, there are chances that you will damage the adjacent hair grafts. So then how you handle the situation? If you are performing it manually, you know what adjustments you have to make in the depth so that you go only up till that particular level and come out. You are not damaging the splayed roots and you are manipulating it in a way that the entire root comes in total. But when the robot is performing it, all that it knows is the settings that you have done. The robot is not able to do the adjustments case by case, graft by graft, the way a person performing himself or herself can do it. And that is why, in order to take care of these transaction errors, one may select a larger punch, which can take care of all the different sorts of grafts. Now, that larger punch will give you wider grafts as compared to thinner grafts with smaller punches. These wider grafts will again need larger slit sizes to place in as compared to smaller slit sizes with smaller grafts. Larger slit sizes will occupy more space, you'll be able to give less density as compared to smaller slit sizes. At the same time, you'll have to make larger holes which will give you more tissue damage as compared to smaller holes. Sometimes it is necessary to use larger punch, but not always. So when you can manage with a smaller punch, you do not need to necessarily go with a larger punch. Now those adjustments are not possible when a robot is performing the surgery. ARTA started long back, almost 7-8 years now, or maybe more than that. But they have passed the machine through constant revisions. So right now they are using version 9. But because of these issues, they are still not able to take care. They are not able to achieve a very nice and natural looking results, due to which it is still not as famous as compared to robot in any other part of medical profession. So then the question is robotic hair transplant surgery better than a surgeon operated or manually performed hair transplant surgery? The answer is no. Robotic hair transplant surgery doesn't necessarily mean that it is better than a manually performed one. In fact, the type of robots that we have to date available, they are not up to the level of an experienced surgeon. An experienced surgeon with good hands and good skill can perform hair transplant surgery in a much better and refined way as compared to robots which are available today are able to perform. We hope that we can overcome some of these obstacles and come out with even better versions or modifications in the automation. But as of now, yes, manually performed surgery can give you better results as compared to an automatically performed surgery. As we know, hair transplant surgery is not just a surgery, it's a surgery combined with art. And it's that art where the human touch is necessary, particularly art attached with human body. One more issue with robotic hair transplant surgery, which I forgot to mention before. It is machine driven. So, all that we have to do is set the parameters and let the machine perform the procedure. You don't really need a doctor all the time to perform this. Anybody can do it. So then, internationally, globally, there are centers where there are a team of people or team of technicians performing this surgery because it's just the machine which is performing. Doctor is not required anywhere. Had it been so simple, then this would not have been a part of medical field. It can be taken care of in any office or any boutique or things like or salon or things like that. But no, surgery has its own risks and challenges attached with it, for which you need proper people or proper person with knowledge to take care of it. So that is why if you're going for a robotic hair transplant surgery, you have to make sure whether a surgeon is available there or not in the first place. And in the second place, whether that particular surgery is going to give you better results with better pricing, or you're going to end up with less good result while spending more for that. I hope this helped you to answer some of your questions. If you have any other queries, please feel free to write to us. See you in the next episode. Thank you.